Hello, I'm Dr. Jay Noreen, and this is Health Talk. Today we welcome Jody Cash, Director of the Paul H. Broyhill Wellness Center, and Eddie Mayo, Director of Orthopedic Service Line of Appalachian Regional Healthcare System. Jody and Eddie, thank you very much for being here. Very much appreciated.
Thanks for having us.
We'd be delighted if you could each tell us a little bit about your careers, how you got into the specialty you're in, and what was your educational background. There are students out there who are probably thinking about exactly the same thing. So Judy, why don't you start?
Okay. Well, I have my master's in exercise science. I started out with an undergraduate degree in biology, thinking I wanted to go to either physical therapy school or medical school, and then became very interested in the field of exercise science after doing an internship at the Olympic Training Center out in Colorado Springs. And so that's kind of how I got interested in it. I grew up exercising and in a medical family, so I knew I wanted some combination of that.
Yeah, great. Eddie, how about you? How'd you get into your career?
Well, I've got a couple of those.
Yeah, all right.
The first one, I became a physical therapist a few years ago after in school in France. I was raised in France, and the counselors in France kind of told us to choose a career path early on, and so I had chosen physical therapy then, not knowing that I would actually end up doing it. And so when I moved to the U.S. Back in 1986, I really focused on PT, and really it's been a good match for me. And then as I practiced for many years, I realized that really I have an interest for leadership and management and administration. And so I went back to grad school and got another degree, and got my MBA with an emphasis on healthcare management. It's been a great experience. It's been awesome.
So you moved from being a clinician to being a clinician executive in many ways.
So to speak, yes.
Yeah,
yes, sir.
Yeah. Well, we'll talk more about what areas you cover, because that'll be real interesting. I know it's a complex set of services that is the orthopedic line. So. Well, Jody, I know you have been sort of the starter of the Wellness Center. You've been with it since its beginning. Could you give us a little bit about just the history of how it's evolved over time?
Sure. So I moved back to Boone in 1995 and was fortunate enough to be able to be in from the planning stages for the Wellness Center. And Richard Sparks felt very strongly that our community needed something like this. There wasn't anything like this for our community. And so everyone involved with it was incredibly supportive, and the community was supportive. And so we opened in March of 1998 and started out with basic wellness center services, and then we added, shortly after that, we added physical therapy into the wellness center. And then we have just continued to grow and expand. In 2006 we just about doubled the size of the wellness center and added some more services. We added aquatics at that time, we added massage therapy at that time, and increased our space for the exercise classes, exercise equipment, and everything else at the same time.
Now, where is the Wellness Center actually?
The Wellness Center is actually over very close to the hospital. It's off of 321 on Boone Heights Drive, so it's over on that side of town.
Okay. Well, you know, I'm an internist by training, and primary care has grown to become much more connected to wellness.
Yes.
How do you relate to the physicians and the PAs and the primary providers in the community?
We actually work with them a lot. When people come in and they're interested in joining the Wellness Center for various reasons, a lot of times they'll need a physician referral if they haven't already received one. Sometimes their physician will be sending them, whether it's maybe to help control diabetes, or maybe to help control their weight or blood pressure, or just to improve their quality of life. If they haven't seen a physician first, then sometimes we will send them back to their physician just to make sure, based on their medical history, that they are cleared for exercise and that it's safe for them to exercise unsupervised.
Well, we want to talk more about that as we get into the conversation. But Eddie, could you talk a little bit about your broader role and how that connects to the Wellness Center and the other activities? I know you're involved in several.
Yes. As the director of the orthopedic service line, you're right, there's a broader spectrum of services that we provide. The idea behind a service line is really more of a horizontal approach to the vertical typical silos that we've had in healthcare. And it really breaks down those barriers and allows the service line to create an environment where there's collaboration And so between the rehab center, between the wellness center, the pain center, the wound care center, and other centers that the service line oversees, there is really a strong collaboration that helps the patient. It is a patient-centered approach that makes it better for them. Mm-hmm. And so that's the reason why I think the wellness center is so nicely situated, because it helps those patients who are no longer in rehab or no longer in the pain center or the wound care center, and helps them continue where their care, they're on their own.
Mm-hmm. So is it the case that let's say somebody has a need for rehab and they're involved in rehab, and then after they've finished their rehab regimen, they might go to the wellness center as a next step? Is that a common kind of an approach?
And we do have actually a transition program from the rehabs. The rehab center is actually located in the same building of the wellness center.
Oh, okay.
At least here in Boone. We also have another rehab center in Linville.
Okay.
That's connected to the Y there.
And
it really is a easy transition to go from having had your therapy, having had your personal intervention from a home program standpoint, and then transitioning to the wellness center with a personal trainer.
Mm-hmm. Now, I can see the connection with rehab. Somebody has a back surgery, and post-back surgery they have rehab, and then they want to get into maybe a growing exercise program that's preventive in nature. What are some of the other problems that would go to your service center and then move over to the wellness center? That's just one example, I suppose. But.
You could have somebody who has a lot of pain and is referred to the pain center. That is located, of course, at the hospital. And the interventionist there may decide to really incorporate an exercise regimen that really is not needed by a PT to provide. That would be a good way for that physician to refer the patient to the wellness center. Mm-hmm. Maybe it could be a internist that has their practice, or maybe somebody from the hospital, where they see a need of that patient and needing something more than what they're currently getting. Mm-hmm. And so the wellness center provides that for them.
Mm-hmm. Well, you described what I think is characteristic of the healthcare system, and hopefully decreasing so, and that is the silos.
The silos,
separate, everything being lots of things.
Well, it is really a strategic approach to reallocating and the planning of and really manpower, mm-hmm. Resources, mm-hmm. and even capital expenses. That you really have to change the way you're thinking to really address the needs of the patient.
Yeah, yeah. Now, the service center is orthopedic, but it sounds like you really have cross-disciplinary primary care medicine, pediatrics, probably.
Yes, and really even going to post-acute care, mm-hmm. where you also have an intervention in terms of the nursing homes, the home health agencies, the outcome of the patients. Currently, we have 2 orthopedic practices in town, one that is owned by RHS, one that mm-hmm. is not, but yet we have to find a way to have a collaborative effort between the 2, so that and us, so that we can better care for the patient. So yeah, it's a soft approach to those hard silos.
Mm-hmm, mm-hmm, mm-hmm. Increasingly needed in healthcare.
You bet.
Now, you'd mentioned something called the Thrive program. What exactly is the Thrive program?
Thrive is one of our clinical programs that we started back in 2011, and the idea at the time was we saw a need. We were working with our cardiopulmonary rehab program, and we put together a team to look at the need for people that didn't qualify for cardiac rehab that we felt like were kind of falling through the cracks, mm-hmm. Whether if their insurance wouldn't cover it based on their diagnosis, based on what their needs were. And so we wanted to develop a program that these people could exercise in a supervised setting. It was a multidisciplinary approach, and so we incorporated nurses, we incorporated dietitians, the rehab center, physical therapists, sometimes occupational therapists, and the exercise specialists to give a true multidisciplinary approach to help them with everything from their exercise routine, quality of life, medication management, lots of different aspects. We quickly added an oncology track, and the primary purpose of the oncology track in Thrive is to look at fatigue management and help with people who are either in treatment, in chemotherapy or radiation oncology, and people who are less than 12 months out of treatment. And then more recently, back in January of 2015, so about a year and a half ago, we added a weight management component to Thrive. And that has been a tremendous program, and it has exploded, and we have had multiple cohorts go through and seen great success with ARHS employees as well as community members in, again, the multidisciplinary approach. We use dietitians, exercise specialists, and behavioral health coaches to look at every aspect of weight management and try to see great success for these individuals.
So the program is of course, for employees of the Appalachian system, but is it also for people around the community at large?
It is. We started with ARHS employees kind of as our pilot group to see how it would work, to see how it would go, and we had such great success with them that we decided to go ahead and offer it to the community as well. And typically in a 12 to 16 week program, which is what we do, the standard weight loss is anywhere from 3 to 5%, and we have seen in our second cohort that we did with the hospital employees, we got almost a 9% weight loss in that group. So that was tremendous.
Wow.
And we actually just this week are finishing up our third cohort for employees and are seeing about 7 to 8% average weight loss. So we've had tremendous success.
Now, how do people in the community, how do they get access to the program, to the Wellness Center, to the Thrive program? How do they get access? I'm interested, what do I do to get in?
Okay, anyone can come in and join the Wellness Center. You don't have to go through a physician. As I mentioned before, sometimes based on your medical history, we will need clearance from a physician. We will need a referral. And sometimes we do find that the physicians will say that they would like them to go through some physical therapy first, for instance, or they might need to be in a supervised cardiac rehab program first. And then we will get them into a wellness program. So we try to direct them into what best meets their needs. We look at everybody as an individual. We don't really have canned programs that we put everybody on. It depends on what their needs are and what their starting point is, kind of where they are in this journey that we call fitness and wellness.
Now, when a person comes for their first visit, who do they meet with first? What's their first point of contact?
The first point of contact will be our front desk staff that will ask them some of these questions about what they're looking for and what their background is, what type of programs they're looking for, and we'll give them a tour of the facility and just kind of run through some different questions to find out what program will best meet their needs. Because in addition to our land-based programs, we also have aquatic programs that are a great fit for people, especially with fibromyalgia, arthritis, chronic pain, and that's where we see some people from the pain center that will come in, and the aquatic classes are a huge benefit for them.
So you're defining wellness pretty broadly. It's both proactive wellness and maybe what you might call reactive wellness,
yes.
Post-acute wellness to move to the next level of really function, in essence.
Definitely.
What about cost? Do people generally have insurance coverage, or what kind of cost is there to a newcomer to the Wellness Center?
Typically, insurance will not cover the general membership for the Wellness Center. However, we do have several different programs. There is a Silver and Fit program, and there is a Silver Sneakers program that some people have through Blue Cross Blue Shield or as a part of a Medicare plan that will cover part of their visits for the Wellness Center. So if they're in a general Wellness Center membership, some people do have access to that for their insurance to cover it. And for the Thrive program, for instance, the insurance won't cover that, but we do have some scholarships available that we have worked with the Hospital Foundation to develop these scholarship funds so that if people can't afford it, that's not a barrier. We're all about getting rid of those barriers to exercise.
And so it may be that insurance covers, but more commonly not.
More commonly not.
Yeah, unless it's a post-acute situation where they're in cardiac rehab or something else.
Right, exactly.
And you mentioned that sometimes cardiac rehab is not covered. In what cases would it not be covered for somebody who's got a cardiac problem?
Sometimes it depends on what their overall diagnosis is. If it's a metabolic syndrome, it used to be that certain heart failure patients didn't qualify, and that's really kind of where Thrive was born. And then more recently, insurance has started to cover the heart failure patients with certain criteria. There are still some criteria that they don't meet, and so then they would be referred into our Thrive program.
Okay. Okay. Now, what about numbers? What's a typical number of patients you see in the wellness center in a given day or in a given week or whatever?
Well, we see a lot of people in the Wellness Center. It's probably the only place in town where at 5:30 in the morning, the parking lot is full. People are waiting at the door to come in. At 11 o'clock, people are circling the parking lot, trying to find a place to park to come in. I like to say that we're the most popular place in town. I don't know that that's true, but it sure feels good. And so we can typically see anywhere from, we probably see about 3,000 people come through the doors every week.
Wow. Wow. 3,000?
3,000 people a week.
Wow, that's pretty incredible. And
Yeah.
that doesn't include the
That
rehab
doesn't
and
include,
other.
no, it doesn't
just
include
the
that at all.
members.
Just the wellness
That's
center.
Wellness Center memberships.
Correct.
Now, how has it grown over you've seen it from the beginning to now? How
have.
has it evolved in terms of numbers over time?
The numbers have evolved with the way our programs have grown. When we first started out, we just had really just basic exercise programs. And now we have more personal training, small group training. We actually have CrossFit at the Wellness Center, which is a whole different mix than Thrive. So we tend to try to run the gamut of all the different programs. The aquatics, like I mentioned, the arthritis programs. We have special classes for senior population. We have special classes for youth strength and conditioning. Lots of different aerobics classes. We have massage therapy. We have yoga, spinning classes. So we have evolved tremendously with all the different offerings that we have. We have dietitians that will see Wellness Center members as well. So we try to look at the whole picture.
Now, you mentioned CrossFit. Say more about what CrossFit is.
CrossFit is a great exercise program that's a little more intense than your typical program. A lot of people see the CrossFit Games on TV and they get very intimidated and think, I can't do that. And my comment to that is, well, you see Michael Phelps swim in the Olympics, and if you swim, we don't expect everyone to look like Michael Phelps in the water, or any of the other Olympic swimmers for that matter. And so there's different levels. And one thing that's really interesting about our CrossFit is we probably do get a little bit of an atypical population being in a wellness center. It's exciting for us to see, just this week, we had a 70-year-old woman that has started doing CrossFit. She's never done it before. And she started this week. This morning we had a woman in a class, she's 67. She hit a new PR on 2 of her lifts. So you see a lot of different things where they're doing Olympic lifts, they're doing body weight movements, they're running, they're rowing, they're doing pull-ups and all kinds of different exercises. So it's a lot of variety. Never do the same workout twice.
So if a person is starting this CrossFit program, what's their schedule for the week, for example?
Well, we have lots of different classes. We do early morning, middle of the day, and evening classes. And they come in and they'll work with our coaches on developing really what is the best plan for them. We don't want them to try to come in and start every day at the highest level. We start out scaling them on maybe the number of repetitions that they're doing, the weight that they're using, the exercises that they're doing. So we try to start people very slowly and gradually, and we're really keyed in on their safety so that they don't get hurt, and so that this is a benefit for their program.
So would they come in, 2-3 times a week typically?
They would.
Is that fairly common?
It is. It's very common.
And come for an hour, say,
Right.
for a session? Is that
Right.
typical? And is it a lot of group activity, or is it more individual?
CrossFit is a group activity.
Oh, it is?
It
Okay.
is. It
How
is
many in a group?
activity. Typically, we have anywhere up to about 15 in a class. So it varies depending on the day and the time. And so.
What about age distribution at the Wellness Center? Is it mostly older people? Are there youngsters who come, or what's the distribution?
We do have youngsters that come. We have everything from, we have youth strength and conditioning classes that we do. We have kids as young as 9 years old that come in, and we have some that will do Zumba with their mom, or they might play racquetball, or they might get in the pool and swim. And we have that age all the way up to, we have an individual in the community who will come in and swim almost every day, and he is, I believe, 94 or 95
wow.
now, and drives himself. and comes in and swims every day.
Oh, that's impressive.
And he is a regular for sure. So we have a wide range of ages at the Wellness Center.
Wow, that's very impressive.
Yeah, it's very
94,
impressive.
95.
Yes.
That's very impressive.
Yes,
as a matter of
it is.
fact.
It is.
Yeah, wow, amazing. Now, there are other wellness programs around the community. I know. I mean, App State University has some. And
Right.
How do you connect or relate to the rest of the community wellness programs? Are there connections there? Do you kind of collaborate professionally, or how does that work?
We do collaborate with them. We try to work with, we work with ASU a lot with student interns and doing some research, especially in our Thrive program, and trying to meet the needs of the community the best that we can. We also try to collaborate with organizations such as the High Country Community Health, Community Care Clinic, those types of groups, to try to get people in the Wellness Center that maybe can't afford the membership, their insurance doesn't cover it, or maybe they don't have insurance. And so we try to collaborate with them so that people can get in and exercise and get whatever they need.
Now, there have been various so-called health risk assessment questionnaire things. What did you use that, and then what do you use? How do they work?
We use the basic ACSM standards.
Okay.
And so based on that, we determine then whether or not they need a medical referral to come in and exercise. And then we do a general orientation / assessment when new people join to see what their needs are, what their goals are, how we need to tailor a program for them. If they've had physical therapy, if they've had other problems, what can we do to tailor the program so that they get the best results?
Okay, good. Eddie, would you say a little more about the related programs? You mentioned the pain management program and, of course, the rehab program. Can you say a little more about that? We've been talking a lot about the wellness program, but can you say a little more about that as well?
Sure, and perhaps as it relates more to the Thrive program as well, because you did mention earlier to Jody, what kind of a relationship you have with other wellness centers. Well, the Y in Avery is also a partner of ours to help with the Thrive participants. We just started a cohort in Avery County of employees of ours that are starting that Thrive program as well. The Thrive program is really linking, in my mind, the community to the healthcare system. And it's our role as providers to making sure that we are giving them what they need. And through the Thrive program, the Wellness Center, the Rehab Center, the Pain Center, the Oncology Center that we have as well, all those areas work simultaneously to really provide what the patient needs. And that's how, even though I have no oversight over the Oncology Center, the mere fact that we're collaborating with them directly and sometimes indirectly is a great sign that there's a great collaborative effort between all of us. And to me, that is where the benefits are, because my efforts alone might influence a patient just a little bit from perhaps an orthopedic standpoint, but it may not influence them enough to make the changes necessary they need to have done to impact their health. In
a more broad sense of health. Yeah. So that's again part of the connecting point.
It is. Right. It is. And we are connecting with not only other healthcare organizations, such as some of the local clinical doctors, but we also are partnering up with the State Department of Health. We're partnering up with High Country Community Health, the Y, App State. We're doing a lot of good things with the students that are coming to us and helping with the research. It's quite remarkable how we've been able to together come up with such a good program.
Now, you mentioned the students from App State. What types of students do you have who are coming and getting experiences with you? Where are they coming from? What disciplines?
We typically see health promotion, exercise science, some athletic training if they're interested in the rehab center, and sometimes the wellness center also. We have dietitians that come over, the dietary students that come over and help with some of the programs. So we see a pretty good mix.
And some are here to learn more about each discipline.
Sure.
But some are here to get their hours in to apply for the program. And some are here because they're already in the program and they need their internships.
Okay. because some of the programs have certain requirements for
bet.
clinical
Right.
experience, and you are meeting some of those
Right.
clinical requirements.
Absolutely.
Yes.
How many students in a given semester do you have?
Oh,
typically?
sometimes we have close to 20 students that
Oh.
come through based on how many different hours they need and what type of programs they're looking for.
Yeah.
Some of them, it's a little bit of involvement. Some of them are doing almost 30 hours a week.
Is the participation continuing to grow? The numbers you were talking about are pretty impressive, 3,000 in a week.
Yes.
Are they
And
continuing
growing.
to grow?
Yes.
Tremendously. We are in the process of forming a coalition with our local partners, such as I mentioned earlier, ASU. We're looking at grants. We're looking at having Remittance Purse involved with us. We're looking at the Department of Health again. I cannot see anything but a bright, large future for Thrive and the Wellness Center.
Impressive. Well, we really thank you for spending time with us. This
Thank
is
you.
a great community resource. And of course, as we all know, this is the direction we need to go in healthcare.
Absolutely.
Yes,
More
it is.
health promotion, more prevention, more increased function of people who have had problems and now are in the post-acute phase. So
Right.
thanks very much for spending time with us.
Thank
Thank
you.
you for having us.
Thank you.
Well, that's our program for this week. If you have questions or comments, you can contact us at watchapptv.com, and please join us again for Health Talk here on App TV. I'm Jay Noreen. Thanks for being with us.